It's no secret that the wait for a kidney transplant is long and agonizing. The sooner you get on the list, the better your chances. But with so much information online, it can be hard to know where to begin. Not to worry, we've got you covered. In today's video, we're going to take you through each stage of the journey, from evaluation to recovery, uncovering the 9 crucial stages of a kidney transplant that everyone should know to improve your chances for transplant success. Whether you or someone you love is battling kidney disease, understanding these stages can make all the difference when it comes to applying for a transplant and looking after the new kidney in the post-transplant stages. And later on in the video, we'll be revealing how you can get your hands on 2 exclusive free gifts to help you on your journey to better kidney health, so stick around for that. But first, let's dive into the stages. Stage 1 is the transplant referral. Most people's kidney transplant journey begins in a nephrologist's office, where kidney disease patients must go to discuss their options. When kidney function dips below a critical level, it's time to start considering a transplant. Kidney function is measured by something called the glomerular filtration rate, or GFR. When this figure falls below 20, it's a strong indication that the kidneys can no longer sustain life without intervention. In other words, it's time to get on that wait list. This referral is more than a recommendation, it's a lifeline. But who gets this lifeline? It's not a blanket decision. The nephrologist considers several factors, such as the progression of the kidney disease, the overall health of the patient, and the patient's potential to thrive post-transplant. Which brings us to stage 2, the Pretransplant Evaluation. This involves a comprehensive assessment where multiple specialists evaluate a patient's suitability for transplant. First on the agenda is the assessment of kidney function. It's not enough to know that the kidneys are failing. Doctors need to understand how severely and in what ways. Advanced imaging tests like ultrasound or CT scans help to provide a clear picture of the kidney structure and any anomalies that might complicate the transplant. But the evaluation doesn't stop at the kidneys. The heart, lungs, and other vital organs are also put under the microscope to ensure they can withstand the surgery. After all, a transplant isn't just about replacing a failing organ. It's about ensuring the body as a whole is prepared for the change. Infectious disease screenings are also crucial, as the immunosuppressive drugs taken post-transplant can make patients more susceptible to infection. At this point, a nutritionist will evaluate the patient's diet and lifestyle, offering guidance on how to optimize their health in preparation for the transplant. Now, you might be wondering, why is this evaluation so extensive? The answer lies in the complexity of transplantation. You see, kidneys don't operate in isolation. They're part of a complex system. The heart, lungs, liver, and even mental health play crucial roles in determining the success of a transplant. For example, heart tests ensure that your heart can withstand the surgery, while lung tests check for any underlying conditions that might complicate recovery. Doctors need to be sure that transplantation is a safe and viable option. Aside from their health, patients are also evaluated for their commitment to the post-transplant regimen, which includes lifelong medication and regular follow-ups. Receiving a transplant is not just a once-off thing. It means a lifelong partnership between the patient and their medical team, built on a mutual commitment to the journey ahead. Many people don't realize that things like their attendance at dialysis sessions can be taken into account at this point. People who can prove consistent dedication to their health will have a better chance of making it onto the list. So, if you're someone who may need a transplant down the line, you should be careful not to skip out on any dialysis appointments and ensure the foods you're consuming are kidney-friendly. If you're not too sure where to start with this, we have lots of videos on our channel to help you navigate nutrition as a CKD patient. So make sure you're subscribed to stay up to speed. Once the referral is made, the patient will be introduced to a transplant center. Here, a transplant coordinator becomes the patient's guide, walking them through the upcoming stages and helping them to apply for the National Transplant List. Now, after that intensive evaluation, you might think things would speed up. Unfortunately, the next step in the process is the longest, often taking years. That's right, stage 3 is the waiting list. The waiting list for a kidney transplant isn't just a simple queue where the first in line gets the next available kidney. The kidney has to be a good match for the patient, otherwise they risk organ rejection. The waiting list is a complex system managed nationally by organizations like the United Network for Organ Sharing in the United States. The UNOS employs a sophisticated algorithm to match donors with recipients. This system ensures that the allocation of kidneys is both fair and medically optimized. Several factors influence a patient's position on this waiting list. Blood type plays a significant role, as some types are more common than others. Tissue compatibility is another crucial factor. Additionally, the presence of antibodies, which can develop from previous transplants, blood transfusions, or pregnancies, may limit compatibility with potential donors, further impacting wait times. But it's not just about medical criteria. Time on the list counts too. Priority increases the longer a patient waits, a policy that aims to balance urgency with fairness. During this time, patients are advised to maintain their health to the best of their ability, staying as transplant ready as possible. This includes adhering to medical advice, following dietary guidelines, and being prepared to arrive at the hospital at short notice. This stage also opens the door to the possibility of a living donor transplant, where a family member or friend offers one of their kidneys. This option can significantly shorten the waiting time, but the potential donor must undergo a rigorous evaluation process to ensure safety and compatibility. The waiting list experience is different for every patient. Some find a match in the space of a few months, while many others will spend years in limbo. Sadly, it is estimated that almost 5,000 people every year pass away before receiving a transplant. For those who make it through this difficult stage, the next step marks a real turning point. Stage 4 is the donor match. Here, the tireless work of transplant teams and the patience of those on the list finally pays off. Once a match is identified, the clock starts ticking. Patients are contacted immediately to come to the hospital. This call is a mix of urgency and celebration. It's the call that patients on the waiting list dream of receiving. But the match is just the beginning. Preparing for the transplant involves a flurry of activity, from final health checks to logistical arrangements, ensuring that both donor and recipient are ready for the life-changing procedure ahead. Now, before we dive into what happens next, we'd like to thank you for watching with your 2 exclusive free gifts. Discover an entire world of kidney-boosting knowledge, tips, and tricks with the Kidney-Friendly Recipe Collection, containing more than 25 recipes for every meal, including dessert. Crafted especially for our viewers with kidney disease, this unique collection focuses on quick and easy recipes to whip up food that's both tasty and great for your kidneys. But that's not all. You'll also get access to the Alkaline Diet and pH Guide for Kidney Disease. This essential guide unravels the critical role of pH balance in kidney health. It includes easy-to-follow advice on testing your pH levels at home, plus practical diet tips to support kidney health. Get each of these powerful gifts for free. Just click the link in the description below and start using these life-changing strategies today. Okay, back to the video, and let's delve into what happens after the donor match. Well, once a compatible kidney has been found, it's time for stage 5, surgery. While the kidney transplant procedure has become increasingly refined over the years, its success hinges on the expertise and coordination of a dedicated surgical team. Here's how the process unfolds. First, the patient is prepped for surgery. They undergo a final set of checks to ensure their body is ready for the new organ. Meanwhile, the donated kidney is carefully preserved, kept on ice, and flushed with a special solution to optimize its function from the moment it's transplanted. To transplant the kidney, the surgical team makes an incision in the lower abdomen, where the new kidney will be placed. Interestingly, the recipient's own kidneys are usually left in place unless there's a specific reason to remove them, such as infection or high blood pressure. This is an attempt to minimize surgical intervention and do only what's necessary for the transplant's success. The most important part of the surgery is connecting the donor kidney's blood vessels with those of the recipient. This is called vascular anastomosis, and it's what allows the kidney to receive the blood supply it needs to start working. The ureter, the tube that carries urine from the kidney to the bladder, is then connected, completing the physical integration of the new organ into the recipient's body. In the initial days following surgery, patients remain in the hospital, where they are meticulously monitored by healthcare professionals for any sign of complications. This is stage 6, the post-transplant recovery phase. Upon waking from the surgery, patients find themselves in a specialized recovery area where their vital signs, blood flow to the new kidney, and overall health are closely watched. It's a time of intense vigilance, with the transplant team on high alert for any signs of organ rejection. The recovery phase also involves a gradual return to physical activity. Patients are encouraged to start moving as soon as possible to prevent blood clots and speed up recovery. Yet, this return to activity comes with its own set of challenges. Patients must balance rest with rehabilitation exercises to avoid overtaxing the new kidney. Nutrition plays a critical role during this time, as a balanced, kidney-friendly diet helps to support healing. Emotionally, the recovery period can be a roller coaster. Relief and gratitude may mingle with anxiety and concern about the future. Support from healthcare professionals, family, and support groups becomes invaluable. The length of the post-surgery recovery phase varies from patient to patient, but after about a week, most are able to go home. However, as we mentioned, the journey doesn't end here. The next phase is Stage 7, commitment to immunosuppressive medication. The introduction of a new kidney into the body is a marvel of modern medicine, yet it's the ongoing management of the immune system that ensures this new beginning can last a lifetime. Upon entering this phase, patients are introduced to a regimen of immunosuppressive drugs. These medications work by dampening the immune system's response, preventing it from attacking the transplanted kidney as if it were an intruder. The key to this stage is customization. The medication is tailored to each patient's specific situation, taking into account the type of transplant, the presence of antibodies, and the patient's overall health. Unfortunately, side effects are a reality of immunosuppressive medications, ranging from increased susceptibility to infections to possible impacts on blood pressure. The transplant team works closely with each patient to manage these effects, adjusting doses and making changes to the medication regimen as needed. Regular blood tests become a routine part of life, helping to monitor drug levels and kidney function, which sparks the need for Stage 8, follow-up care. Each follow-up visit is an opportunity for the transplant team to assess kidney function through blood and urine tests. They also adjust immunosuppressive medication dosages as needed to maintain the delicate balance between preventing rejection and minimizing side effects. Follow-up care also involves managing the emotional and psychological aspects of life post-transplant. Support groups, counseling, and resources for dealing with the complexities of life after a transplant are made available to patients at this time. And finally, the 9th and last stage of the transplant journey is long-term monitoring. Once patients have reached a steady equilibrium with their medication dosage and moved away from the need for regular checkups, they'll transition to this stage. Just because their checkups aren't as regular, it doesn't make them any less important, and patients must commit to these appointments for the rest of their lives. Long-term monitoring isn't just a medical necessity, it's a testament to the resilience of patients and the dedication of the transplant community. It shows that a transplant is not just a one-time treatment, but a lifelong journey of care and commitment. It's clear how important each stage of the kidney transplant process is, but also remember that your diet plays a huge role in your kidney health. For some simple ways to improve your kidney diet, make sure to check out your free gifts in the description below. If you found this helpful, please like this video and make sure you subscribe for all the latest kidney intel. Stay healthy, and we'll see you next time.